So at the moment, there's not much, there's not a whole lot of data about which patients get these cardiovascular side effects. Now, for atrial fibrillation, there is, from ibrutinib, there's a general feeling that older patients with hypertension and abnormal ECG and abnormal hearts are the ones who get more atrial fibrillations than, than those who don't. So we didn't examine specifically in this study whether the risk factors, the event rates were pretty low anyway. But you extrapolate from this study that zanubrutinib causes less atrial fibrillation and less hypertension, which if you like, I can go into more detail about. Then one would say, well, those patients who potentially have a history of hypertension or have a history of atrial fibrillation or have an abnormal ECG or an abnormal echocardiogram, maybe they're the ones who would be better off on Zanu compared to ibrutinib because of the lower risk of atrial fibrillation and worsening of hypertension. We think is how clean the targeting is. So, we don't really know what causes hypertension and atrial fibrillation. If you look at congenital BTK deficiency, so these are humans who are born without BTK, they don't really get atrial fibrillation or hypertension. So presumably you can dispense with BTK and be okay from a cardiovascular point of view. So we think that ibrutinib causes some of these side effects because it's not totally clean. So it inhibits like TAC and and EGFR and and JAK3 and a whole heap of other enzymes which are structurally related to BTK. Now, neither Zanu or Keller are totally clean either, but they're cleaner in comparison. So for the same BTK inhibition effect, you're getting less off-target enzyme inhibition. And I don't think anyone can actually put a heart on the hand and say, it's this enzyme that's causing it. But we just know that the cleaner it is, the better the profile. And it's not just like, hypertension and atrial fibrillation, a whole multitude of other side effects like muscle spasm, peripheral edema, pneumonitis to all reduce, or pneumonia, but was reduced in Zanu compared to ibrutinib. And I think a lot of the sort of pneumonia were in fact pneumonitis because there's no real reason why there should be such a big difference in infective pneumonia rate. Correct. So the drug is easier to take, so less side effects, less dose reduction. People can stay on it for longer. In terms of cumulative risk, so we actually examined the cumulative risk of atrial fibrillation and hypertension over time, and you see that for Zanu, essentially, most of the events happen in the first 12 months, and then it sort of plateaus. Whereas for ibrutinib, we've seen an increasing cumulative pattern, suggesting that you are going to take this drug for let's say 3 or 5 years, that Zanu may be a bit better because there's not a cumulative effect on the cardiovascular system, whereas ibrutinib appears to have one.